A third of Americans are showing signs of clinical anxiety or depression. Census Bureau data, taken over 90 days beginning the end of April, showed a huge jump in anxiety and depression from before the pandemic. Some groups are harder hit than others. Young adults, women, and the poor report higher rates of anxiety and depression. COVID has been hard on our kids. A survey of almost 1,800 children in the Hubei province, China, during the height of the pandemic there, found that almost a quarter of elementary school students had symptoms of depression and 19% had anxiety symptoms after 2 or more months of home confinement.
The disruption of our normal rhythms is terribly anxiety-provoking. The lack of true interaction, the lack of being able to reach out and touch people that you care about and you love. There are things they can do.
Dr. Mark Rappaport is the head of psychiatry at Emory University. He says there are several things we can do to help ourselves.
Talk about it with their friends and others, other people experiencing the same thing. You know, there's almost a sense that of shame about all of this, a sense of, oh, you know, I must be unusual or I must be doing something wrong if I have these feelings. No, everyone has these feelings. None of us have ever been in this situation before.
Rappaport says positive psychology shows that if we give ourselves something to look forward to, such as a trip in the future or seeing friends, it's helpful. And don't sit around.
We need to exercise. We need the physical release. We know that if you exercise, whether you're doing weight training or whether you're doing a walk for 20 minutes or so, we know if you do this, that it decreases symptoms of depression and decreases symptoms of anxiety.
Our lives are not as defined. What's a weekend? Does the workday ever end? Rappaport says we need to draw those lines for our mental health. Take breaks. Switch gears. Actually, physically change locations, even if it's only from your bedroom office to another part of the house. And if nothing is working, seek professional help. Telehealth allows you to safely access resources.
It's not a sign of weakness. It's not a sign of failure. It's a sign of being responsible and caring not only for yourself, but for your loved ones.